What would you do if you were completely alone and suddenly felt the terrifying signs of a stroke beginning? In the next 18 minutes, I'll show you 6 life-saving steps that could mean the difference between surviving a stroke alone and becoming another tragic statistic. Steps that every senior must know by heart. Step number 3 is so critical that emergency room doctors say it can double your chances of surviving and recovering fully, yet 90% of people have never heard of it. Arthur, a 73-year-old widower from Kansas City, was alone in his kitchen when he suddenly felt dizzy and noticed his left arm going numb. Because he knew these 6 essential steps, he's alive today and made a full recovery, unlike his neighbor who experienced similar symptoms just 2 months earlier. Step 1. Recognize the warning signs. Immediately, can you identify a stroke happening in the first crucial minutes when every second counts? The ability to recognize stroke symptoms immediately is the single most important factor in determining whether you survive and how well you recover from this medical emergency. Most people wait far too long to seek help because they don't recognize the subtle, early warning signs, or they convince themselves the symptoms will pass on their own. This delay can be fatal because brain cells die rapidly during a stroke, and the longer you wait, the more permanent damage occurs to your ability to speak, move, think, and function independently. The American Stroke Association and Mayo Clinic have developed the FAST method to help people recognize stroke symptoms quickly and accurately. FAST stands for face drooping, arm weakness, speech difficulty, and time to call emergency services. Face drooping means one side of your face feels numb or droops when you try to smile, creating an uneven or lopsided expression. Arm weakness occurs when you can't raise both arms equally, or one arm drifts downward when you try to hold them up. Speech difficulty includes slurred words, strange phrases, or complete inability to speak or understand others. Time emphasizes that recognizing any of these signs means you must call for help immediately without any delay or second guessing. Additional warning signs that many seniors don't recognize include sudden severe headache unlike any you've experienced before, sudden vision loss or double vision in one or both eyes, sudden dizziness or loss of balance, and sudden numbness or weakness in your face, arm, or leg, especially on one side of your body. These symptoms can appear gradually or all at once, and they might come and go, which tricks people into thinking they're not serious. However, even temporary symptoms require immediate medical attention because they often indicate a mini-stroke that precedes a major stroke within hours or days. Helen from Detroit saved her own life by recognizing facial drooping when she looked in her bathroom mirror one morning and noticed her smile looked crooked. She immediately called emergency services and received treatment that prevented permanent damage. Learn these warning signs by heart right now and don't wait to see if symptoms improve on their own. Step 2. Call 911 immediately. Never drive yourself. Why is calling 911 infinitely better than trying to drive yourself to the hospital during a stroke emergency? When you call emergency services, paramedics can begin life-saving treatment immediately while transporting you to the hospital, essentially giving you a mobile emergency room that starts working to save your brain before you even arrive at the medical facility. Emergency medical services teams are specifically trained to handle stroke patients and can administer treatments, monitor your vital signs, and communicate directly with the hospital to prepare the stroke team for your arrival. This coordination can save 30 to 60 minutes of treatment time, which translates directly into better outcomes and reduced permanent disability. Research from Johns Hopkins Emergency Medicine Department shows that stroke patients who arrive by ambulance receive treatment an average of 15 minutes faster than those who drive themselves or are driven by family members. This time Difference occurs because ambulance crews can bypass normal emergency room procedures and take stroke patients directly to specialized treatment areas where neurologists are already waiting. Additionally, paramedics can start intravenous lines, administer oxygen, monitor heart rhythms, and perform other critical interventions that aren't possible when you're driving yourself to the hospital. Attempting to drive yourself during a stroke is extremely dangerous because stroke symptoms can worsen rapidly while you're behind the wheel, putting you and innocent people at serious risk. Your vision might suddenly become impaired, your coordination could fail, or you might lose consciousness completely. Even if you feel capable of driving when symptoms first appear, this can change within seconds as the stroke progresses and affects different areas of your brain. Always call 911 first, even if you feel slightly better after the initial symptoms, or if you think you might be overreacting to minor signs. Emergency dispatchers are trained to assess stroke symptoms over the phone and can provide immediate guidance while help is on the way. They can also alert the receiving hospital about your condition so the medical team can prepare specific treatments before you arrive. Vincent from Phoenix collapsed while attempting to drive himself to the hospital during a stroke and caused a serious accident that injured 2 other people. Never hesitate to call 911 the moment you suspect stroke symptoms, regardless of how mild they might seem. Step 3. Take aspirin while waiting for help. This one action can dramatically improve your survival chances if done correctly and could be the difference between minor disability and catastrophic brain damage. Taking aspirin during the early stages of an ischemic stroke, which accounts for about 85% of all strokes, can help prevent blood clots from growing larger and blocking additional blood vessels in your brain. However, this step requires careful consideration because aspirin can be dangerous if you're having a hemorrhagic stroke, where bleeding is occurring in the brain rather than a blockage. The American Heart Association's emergency stroke protocols recommend that people experiencing stroke symptoms should chew 1 regular strength aspirin, 325 milligrams, while waiting for emergency services, but only if they're certain they haven't been told to avoid aspirin by their doctor and they don't have a history of bleeding disorders. Chewing the aspirin rather than swallowing it whole allows the medication to enter your bloodstream faster through the tissues in your mouth. This rapid absorption can begin working to prevent further clot formation within minutes, rather than the 30 to 60 minutes it takes for swallowed aspirin to take effect. The key is to have aspirin easily accessible in your home, preferably in multiple locations like your kitchen, bedroom, and bathroom, so you don't waste precious time searching for it during an emergency. Keep the aspirin in clearly marked containers that you can open easily, even if your hands are shaking or you're experiencing weakness on one side of your body. Regular strength aspirin works better than low-dose aspirin for stroke emergencies, because the higher dose provides more immediate anti-clotting effects. Never take aspirin if you've been specifically told by your doctor to avoid it, if you're allergic to aspirin, or if you're already taking blood-thinning medications without medical supervision. If you're unsure about whether you should take aspirin during a stroke emergency, focus on the other steps and let the paramedics make this decision when they arrive. However, for most seniors without contraindications, aspirin can be a life-saving intervention during the critical first minutes of a stroke. Brenda from Miami credits chewing aspirin immediately after recognizing her stroke symptoms with preventing severe brain damage and allowing her to maintain her independence. Keep aspirin within easy reach starting today and know exactly where to find it during an emergency. Step 4. Position yourself safely to prevent falls. How can you protect yourself from additional injury while experiencing stroke symptoms that might affect your balance and coordination? During a stroke, your risk of falling increases dramatically because the brain areas controlling balance, spatial awareness, and muscle strength may be compromised. A serious fall during a stroke can cause head injuries, broken bones, or internal injuries that complicate your medical treatment and significantly worsen your prognosis. The combination of stroke damage and trauma from falls creates a medical emergency that's much more difficult to treat and has higher rates of permanent disability or death. Cleveland Clinic's stroke emergency guidelines emphasize the importance of getting to a safe position as soon as you recognize stroke symptoms, before weakness or dizziness can cause you to fall unexpectedly. The safest position is sitting on the floor with your back against a wall or lying flat on the floor in an area where you won't hit furniture or other objects if you lose consciousness. If you're upstairs when symptoms begin, don't attempt to walk down the stairs, as this is extremely dangerous when you might have impaired coordination or sudden weakness. Choose a location near a telephone if possible, so you can call for help without having to move again. If you have a mobile phone, keep it with you at all times, especially if you live alone or spend significant time by yourself. The floor might seem uncomfortable, but it's infinitely safer than risking a fall from a standing position that could cause traumatic brain injury on top of your stroke. Remove any nearby objects that could cause injury if you need to lie down quickly, and make sure you're wearing clothes that allow you to move easily and stay warm while waiting for help. If you feel nauseous, turn onto your side to prevent choking if you vomit, but avoid changing positions unnecessarily once you're safely situated. Kenneth from Seattle prevented a serious head injury by immediately sitting on his kitchen floor when he noticed sudden weakness and dizziness during his stroke. Practice safe positioning techniques before you ever need them, so they become automatic responses during an emergency. Step 5. Stay calm and conserve your energy. Why does staying calm literally help save your brain tissue during a stroke emergency? When you panic or become extremely anxious during a stroke, your body releases large amounts of stress hormones like adrenaline and cortisol that increase your heart rate, raise your blood pressure, and cause your blood vessels to constrict. These physiological changes can worsen the damage occurring in your brain by reducing blood flow to areas that are already compromised and increasing the pressure inside your skull. Staying calm isn't just good advice for emotional reasons. It's a critical medical intervention that can limit the extent of brain damage and improve your chances of recovery. Harvard Medical School's research on stress and stroke outcomes shows that patients who remain relatively calm during stroke emergencies have significantly better outcomes than those who experience severe panic or anxiety. The study found that high levels of stress hormones during a stroke can expand the area of brain tissue that dies and increase the likelihood of complications like dangerous blood pressure spikes or heart rhythm abnormalities. Conversely, patients who practice calm breathing techniques and avoid unnecessary physical exertion help preserve brain function and maintain more stable vital signs. Focus on slow, deep breathing through your nose if possible, taking approximately 4 seconds to breathe in and 4 seconds to breathe out. This controlled breathing pattern helps activate your body's natural relaxation response and counteracts some of the harmful effects of stress hormones. Avoid unnecessary movement or physical exertion that can increase your heart rate and blood pressure during this critical time. If you find yourself becoming panicked, remind yourself that help is on the way and that staying calm is one of the most important things you can do to help yourself survive and recover. Try to think about peaceful, calming thoughts or memories that make you feel safe and relaxed. Some people find it helpful to pray, meditate, or repeat calming phrases to themselves while waiting for emergency services to arrive. Dolores from Denver remained calm and focused on steady breathing during her stroke, and her doctors noted that her vital signs stayed remarkably stable throughout the emergency, contributing to her excellent recovery with minimal lasting effects. Practice calming techniques regularly so you can use them effectively during any medical emergency. Step 6. Unlock your door and turn on outside lights. What simple preparation can save precious minutes when paramedics arrive and potentially determine whether you survive your stroke? Every minute that passes during a stroke results in the death of approximately 1.9 million brain cells, making speed of treatment absolutely critical for your survival and recovery. If paramedics can't get into your home quickly, they might waste valuable time breaking down doors, finding alternative entrances, or waiting for police assistance to gain entry. These delays can mean the difference between receiving life-saving treatment within the optimal time window and suffering permanent brain damage that could have been prevented. Emergency medical services response time studies show that locked doors and poor exterior lighting are among the most common preventable delays in stroke treatment. Paramedics arriving at a home with locked doors and no exterior lighting must first locate the patient, determine the best entry point, and then find ways to access the home safely, all while carrying heavy medical equipment in potentially dangerous conditions. This process can add 5 to 15 minutes to treatment time, which represents millions of additional brain cells lost unnecessarily. After calling 911, unlock your front door and turn on your porch light, even during daytime hours when the additional illumination helps paramedics locate your address quickly. If you have multiple locks, unlock all of them, including deadbolts, chain locks, and any security devices that might slow down the emergency response team. Make sure the path to your door is clear of obstacles like potted plants, bicycles, or other items that could delay or injure paramedics rushing to help you. Consider keeping a spare key in a lockbox near your front door or giving a key to a trusted neighbor who's usually home during the day, so emergency responders have alternative ways to access your home if you become unconscious before they arrive. If you live in an apartment building, make sure paramedics can access the building by propping open lobby doors or asking neighbors to watch for emergency vehicles. Marcus from Orlando's quick thinking to unlock his door and turn on all his lights allowed paramedics to reach him within seconds of their arrival, and they were able to start treatment immediately rather than wasting time gaining entry to his home. These seconds of preparation could determine your recovery outcome and save your life. Knowing these 6 life-saving steps gives you the power to potentially save your own life during one of the most frightening medical emergencies that can strike without warning. The difference between surviving a stroke with minimal damage and suffering permanent disability often comes down to how quickly and correctly you respond in those first critical minutes when you're completely on your own. Every senior should memorize these steps and review them regularly, because preparation and knowledge can literally mean the difference between life and death when a stroke strikes. Please let me know in the comments whether you have emergency supplies like aspirin easily accessible in your home, and share which of these steps you plan to practice or prepare for immediately. Give this video a thumbs up if this information could help save your life or the life of someone you care about. And please share it with other seniors who need to know these critical survival strategies that could make all the difference during their most vulnerable moments.